Headaches. They are the uninvited guests that show up at the most inconvenient times, disrupting our days and stealing our focus. Almost everyone has experienced a headache at some point in their lives. The World Health Organization estimates that nearly half of all adults globally experience a headache each year. My work as a neurologist has introduced me to countless individuals grappling with the burden of headaches. From the student struggling to concentrate in class to the artist unable to find solace in their craft, headaches cast a long shadow, affecting not only our physical well-being, but also our emotional and social lives. Understanding the nature of our headaches is the first step towards effectively managing them. Headaches are not a one-size-fits-all phenomenon. They present in various forms, each with its own set of characteristics, triggers, and treatment options. By arming ourselves with knowledge, we can better navigate the world of headaches, learning to distinguish between those we can manage independently and those that necessitate professional guidance. Tension headaches are the most prevalent type of headache, often described as a tight band or pressure encircling the head. These headaches typically range in intensity from mild to moderate, rarely reaching the debilitating levels associated with migraines. Several factors can contribute to tension headaches, including stress, poor posture, muscle tension in the head, neck, or shoulders, and even eye strain. Imagine a day filled with deadlines, leading to hours hunched over a computer screen. The muscles in your neck and shoulders tighten, your eyes strain to focus, and before you know it, a dull ache begins to spread across your forehead. Fortunately, tension headaches often respond well to simple lifestyle modifications and over-the-counter pain relievers. Taking regular breaks from work or study, practicing relaxation techniques like deep breathing or meditation, and engaging in gentle physical activity can help alleviate muscle tension and reduce the frequency and intensity of tension headaches. Over-the-counter pain relievers such as ibuprofen or acetaminophen can also provide effective relief. If tension headaches persist or interfere with daily life, consulting a healthcare professional is advisable to rule out any underlying medical conditions and explore alternative treatment options. Migraines are more than just bad headaches. They are complex neurological events that can cause a range of debilitating symptoms, often lasting for several hours or even days. While pain is a hallmark of migraines, it is often accompanied by other sensory disturbances, collectively known as aura. Imagine a shimmering light in your peripheral vision, gradually expanding and distorting your visual field. You might experience blind spots, see zigzag patterns, or even lose vision temporarily. The pain associated with migraines is often described as a throbbing or pulsating sensation, typically on one side of the head. This pain can be so severe that it interferes with daily activities, forcing individuals to retreat to dark, quiet rooms, hoping to ride out the storm of symptoms. Nausea, vomiting, and sensitivity to light, sound, and even smell are common companions of migraine headaches, further adding to the misery. While the exact causes of migraines remain elusive, researchers believe they involve complex interactions between the brain and blood vessels. Identifying and avoiding these triggers, whenever possible, is an essential part of migraine management. Cluster headaches are aptly named for their tendency to occur in clusters, with multiple headaches occurring over days, weeks, or even months, followed by periods of remission. These headaches are notorious for their excruciating pain, often described as a sharp, piercing, or burning sensation, typically felt on one side of the head, often around the eye. Imagine being jolted awake in the middle of the night, every night at the same time, with an intense, searing pain behind one eye. This agonizing pain, often accompanied by restlessness and agitation, is the hallmark of cluster headaches, aptly nicknamed alarm clock headaches due to their predictable timing. The pain is usually accompanied by autonomic nervous system symptoms on the same side as the headache, such as a watery eye, nasal congestion, or a drooping eyelid. These attacks typically last between 15 minutes to 3 hours and can occur multiple times a day, often at the same time each day. While there is no cure for cluster headaches, various treatment options are available to manage the pain and reduce the frequency and duration of attacks. These include oxygen therapy, triptan medications, and nerve blocks. Sinus headaches, as their name implies, are headaches that are associated with inflammation or congestion in the sinuses, the air-filled cavities located behind the forehead, cheekbones, and nose. These headaches are often characterized by a deep, constant pain and pressure in the forehead, cheekbones, and bridge of the nose, often worsening when bending over or lying down. Now, imagine a cold or allergy settling in, clogging your sinuses and creating a buildup of pressure that seems to radiate throughout your face. This pressure, often accompanied by a dull, aching pain, is the hallmark of a sinus headache. Unlike other types of headaches, sinus headaches are often associated with nasal congestion, facial tenderness, and a reduced sense of smell. Treatment for sinus headaches typically focuses on addressing the underlying cause of the sinus inflammation. Over-the-counter decongestants and saline nasal sprays can help relieve congestion, while pain relievers such as ibuprofen or acetaminophen can reduce pain and inflammation. If sinus headaches are frequent or severe, a doctor may recommend a referral to an ear, nose, and throat specialist, ENT, to rule out any structural abnormalities or chronic sinus conditions. While most headaches are benign and resolve on their own or with over-the-counter medications, some headaches can be a sign of a more serious underlying medical condition. It's crucial to be aware of the warning signs that distinguish a typical headache from one that warrants immediate medical attention. Imagine a headache that comes on suddenly and severely, often described as the worst headache of your life. This type of headache, known as a thunderclap headache, can be a sign of a ruptured aneurysm or bleeding in the brain, requiring immediate medical intervention. Other red flags include headaches that are accompanied by fever, stiff neck, confusion, seizures, weakness, numbness, or difficulty speaking. Headaches that worsen progressively over time or change in character are also cause for concern. For example, a tension headache that starts to resemble a migraine or a headache that becomes more frequent or severe should be evaluated by a healthcare professional. Early diagnosis and treatment of underlying medical conditions can significantly improve outcomes and prevent potentially life-threatening complications. While medication can provide much-needed relief from headaches, lifestyle modifications play a crucial role in managing and preventing headaches in the long run. One of the most effective lifestyle modifications for headache management is stress reduction. Stress is a known trigger for various types of headaches, including tension headaches and migraines. Engaging in stress-reducing activities such as yoga, meditation, deep breathing exercises, or spending time in nature can help lower stress levels and reduce headache frequency. Regular physical activity is another cornerstone of headache prevention. Exercise releases endorphins, natural pain relievers that can help alleviate headache pain. Aim for at least 30 minutes of moderate intensity exercise most days of the week. However, it's essential to listen to your body and avoid overexertion, which can trigger headaches in some individuals. Adequate sleep is crucial for overall health and well-being, including headache prevention. Establish a regular sleep schedule, going to bed and waking up at approximately the same time each day, even on weekends, to regulate your body's natural sleep-wake cycle. The over-the-counter OTC medication aisle can feel like a labyrinth of options when you're battling a headache. Understanding the different types of OTC pain relievers and their mechanisms of action can help you make informed choices and find effective relief. Acetaminophen, commonly known as Tylenol, is a widely used OTC pain reliever that works by blocking pain signals in the brain. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, known as Advil or Motrin, and naproxen, known as Aleve, work by reducing inflammation and blocking pain signals. They are effective for mild to moderate pain and can also help reduce inflammation associated with headaches. However, NSAIDs can cause stomach upset, heartburn, and even ulcers in some individuals, especially with long-term use. It's important to read and follow the directions on the medication label carefully and consult a pharmacist or doctor if you have any questions or concerns. While most headaches can be managed with self-care measures and over-the-counter medications, some headaches require professional medical attention. Knowing when to seek medical advice is crucial for ensuring timely diagnosis and treatment of any underlying medical conditions, and preventing potential complications. If you experience a sudden severe headache, especially if it's the worst headache of your life, seek immediate medical attention. This type of headache, known as a thunderclap headache, can be a sign of a serious underlying condition, such as a ruptured aneurysm or bleeding in the brain. Headaches that are accompanied by other neurological symptoms, such as fever, stiff neck, confusion, seizures, weakness, numbness, or difficulty speaking, also warrant immediate medical attention. These symptoms could indicate a serious underlying medical condition, such as meningitis, encephalitis, or a brain tumor. Headaches that worsen progressively over time or change in character should also be evaluated by a healthcare professional. Living with headaches can be challenging, but it doesn't have to control your life. By understanding the different types of headaches, their triggers, and treatment options, you can take an active role in managing your headaches and improving your quality of life. Keep a headache diary to track your headaches, noting the date, time, duration, intensity, and any associated symptoms or potential triggers. This diary can be an invaluable tool for identifying patterns and triggers, which can help you and your doctor develop an effective treatment plan. Communicate openly and honestly with your doctor about your headaches, providing detailed information about your symptoms, triggers, and any medications or supplements you're taking. This open communication will help your doctor make an accurate diagnosis and recommend the most appropriate treatment options for your individual needs. Remember that you are not alone in this journey. Headaches are incredibly common, and there are resources available to support you.